We are on time.
Yes, sir. Good evening, sir.
Good evening.
One more minute to go, then we'll start.
Is Vishpala joining?
Chances are less. I don't think.
Yes,
I will ask her. I will ask her.
प्रदीप गार्गे का आंख खराब हुआ, कान तो खराब नहीं हुआ ना? He can listen.
He might be there some listening. Yes, sir. Shall we start, sir?
Yes.
So, good evening, everybody. I just spoke to Dr. Vishpala ma'am and she has sent her blessings to all of us. She is little unwell, so she can't join us. And friends, today's our esteemed speaker is Dr. Praveen Suvarna, sir. There are a lot of changes which has happened in earlier. It was supposed to be Dr. Pradeep, sir, but he has got bad conjunctivitis and the last minute change. And see, it is like, the amazing solidarity that Dr. Praveen Suvarna, sir, agreed at the last moment to speak on to that keynote prescribing on the same topic. And we have him over here and we are really grateful. The whole Engage team and all our, sir, the participants are very grateful to you. Thank you very, very much, sir, that you are here with us. You agreed for this webinar. So I will like to introduce Dr. Praveen Kumar, sir. Most of you must be knowing him, but still, like, he is a retired principal and HOD of the Department of Medicine at JSPS Government Homeopathic Medical College, Hyderabad. He is a professor and HOD at JIMS Homeopathic Medical College, Hyderabad. He's a trustee and PRO of Global Homeopathy Foundation. He's an associate editor of Engage and Telangana government's first best teacher award winner for 2017. Okay, he's also like Dr. B.K. Bose Memorial National Best Teacher Award winner for the year 2005. Dr. Mahendra Singh Memorial National Best Teacher Award for 2014 and PG Guide and Examiner for many universities in India. PG Guide at Hahnemann Homeo College, London, Associate Editor of NGH, visiting professor to many PG institutes. And we are so lucky to have him over here. And the topic that he is going to talk on to is the keynote prescribing. And he is a wonderful orator and a vivacious speaker. And I'm sure that, this lecture is going to be not only the best of the learning, but with full of, fun, and you will enjoy this learning. So with this, I welcome Dr. Praveen Suvarna, sir. Welcome, sir. It is very difficult for him. He is traveling. He doesn't have his laptop. He has still joined us with his mobile and he is still there with us. I'll be sharing his PPT, but he will be taking up the lecture. So, sir, we are looking forward to learn from you and really grateful to you. Under all the odd situations, you have taken up this challenge. Thank you very much, sir.
Thank you, Dr. Shobha. Thanks a lot for your kind words.
Sir, I'll share. Shall I share your PPT, sir?
Yeah, you start sharing in between.
Yes, sir.
I would be chatting with my friends who have joined the NGH webinar here. And I am reminded of one incident which has occurred like when Albert Einstein has invented a principle, theory of relativity and other things were already in vogue, and he invented one principle which he was narrating in every seminar and every conference. But what happened After at least 20-25 seminars, his driver got bored. He said, "What is this, sir? Every time you are speaking of the same principle, same science, same lecture. It is so boring. Even I can speak." So in one seminar, he said, "Nobody knows me. Now you speak." So the driver started speaking on behalf of Einstein, but in the disguise of Einstein. Nobody knew that it was Einstein's driver. And he spoke at length about this principle, narrated everything, because he has been listening for more than 25 occasions or so. Then one scientist got up and asked one question. Then the driver was so smart, he said, "This question, so simple, even my driver can answer." Now, this situation, the simile I wanted to draw, because our Pradeep Garge is Albert Einstein and I am his driver, I just took it over. So if at all you have any questions, my driver would answer, right? So that doesn't matter anyway. Now, in fact, coming back to the topic proper, keynote prescription. Why is it important? Friends like Dr. Subhash Singh and others from Kolkata, they would be well versed with keynote prescription in homeopathy. Most of us would dwell a lot of time in taking the case, prescribing a right remedy through different means and ways. But keynote prescription is also one of the methods of prescribing a right remedy in those different odd occasions. But what do we need in this keynote prescription? We need a keen observation. It doesn't mean that in other cases, other prescriptions you don't require. But in keynote, because my guru, Dr. N.S. Prashant, used to tell, the most characteristic feature of a patient is narrated by the patient as a passing remark. He would never tell you that please underline this symptom. It is very important. It is keynote. It is characteristic. He would never tell that. Why? The reason behind this is unique. This is peculiar. This is not seen in any other patient of his disorder. So the patient himself would think always that this is not so important, which is only confined to him. So he would never reveal this case, this point. When he doesn't tell this, how could you catch it? So it needs, you have to probe a little and give him such an information or such an encouragement that he should be able to tell you, narrate all the points, whatever they have been dealt with or he has been experiencing. So that is what like the keynote. That is the keynote, or that is the most important characteristic feature in this every particular case. And if you can catch that characteristic feature in the case, it would obviously, even a biggest bungalow will have a big lock, but a key which can open this lock and we can open the door and you can enter into the big bungalow. So this is what like the keynote. That keynote, that characteristic feature would speak of the whole constitution of an individual, the whole scenario, the disease picture in this patient. And that would be very useful for any physician. But we should remember that in all the cases, we can't get keynotes, number one. Number two, most of the cases, we will be in a stereotype asking several questions, probing so much, getting a lot of information, and there would be almost like a maze of symptoms. And you will be lost in that, and you will probably get that plethora of symptoms and select a right remedy basing on the number of totality of symptoms, and then you would be very happy. But most often than not, if the patient important characteristic symptom is not covered by your drug, it would not be able to cure the patient. You have to come back to that characteristic feature at any cost. Now we will start with one case. 43-year-old gentleman, a very close family friend. He came to us with fever 2 days, with mild chills, severe headache, as if being hammered. Now we will jump to conclusion. It could be natural muriaticum. Okay, right. aggravation night, aggravation rest, extreme weakness, profuse sweat after taking paracetamol tablet. This is very common. Next. One slide before, Dr. Shobha. One slide before. Yes. Loss of appetite, thirst moderate, constipated since 3 days, which is very common. Most of the people who don't take food when they are sick, especially such type of intermittent fevers and all. So their bowel movements would be restricted. Even when he has fever or headache, he keeps on moving in his room while talking on mobile. Most of the people, including my own younger son, Dr. Anish, he would not sit at one place while talking on phone. So this is most of the times a habit of a person. It could be his habit. We don't know. But this was observed, this was narrated by the attendants as well. So very nervous patient, highly anxious, even otherwise very anxious, hardworking. He has established his factory and he has established his factory branches in other, I think, 5 states, Goa, Rajasthan, many other places. Very principled. He would not compromise for the principles and very affectionate. He takes care of his family members, his friends, his relatives very well. And he cannot bear contradiction. Basing on this totality, without doing any repatriation, most of the times in acute cases, I don't do the repatriation. I have just selected basing on my little memory, arsenic amalgam 200 too early, and asked him to go for RT-PCR test. This was like 2019. Now the test, next please, was shown on 30th September 2020. He was in the peak HRCT chest, Corads 4. So when he came with the report, his fever, which was intermittent, it did not subside. He was not feeling well. This obviously tells you that your drug was not correct. The patient did not improve at all. So you have to rethink what could have gone wrong. You can't experiment with 1, 2, 3, 4 choices. So something went wrong. The wife and father told a peculiar symptom during fever. He was scolding everyone in the house, even without any reason. The scolding makes a positive, important characteristic feature. I'll give you one more example, though not connected to this. A small child of 8-year-old, a boy, he was brought to the clinic. And I asked the boy, the parents narrated he was having severe pain in the throat, swallowing difficulty, fever, little cough, all these points. But at the same time, I asked the child to open the mouth to visualize to see what has happened as per pathology. So the father whispered in my ears and he said, can he keep this mouth open for as long as possible? I said, he can't. He has to close his mouth. Why? He said, since yesterday night after he got this fever pain in the throat, he has been abusing him in such a very unparliamentary way. So he could not bear it. He was scolding his father, very abusive with pain. You have certain drugs like Corallium rubrum, Heparsulf, Chamomilla. So we can select. I have selected Corallium rubrum basing on different symptomatology as well. So that prompts you to give more importance to this characteristic feature, not just the common symptoms of fever, cough, cold, and chills or appetite. They are all important, but they are not that important when compared to this important characteristic keynote, abusive during intermittent fever. Ferromet is the only remedy. So when it was given, everything became all right. Fever subsided. Patient became completely all right, feeling very well. And to my satisfaction, I asked him to go for RT-PCR and mind well, not even 1 week passed. And RT-PCR, you can't get negative in 1 week, at least at that time. but I wanted to see that. So the next RT-PCR test report next was negative on 6th October. 30th September was positive. 6th October, it was negative. So HRCT test was also done. It showed only Corads 3. It was for Corads 4 earlier, and later it became Corads 3. Now, what do we the most characteristic keynote symptom of this patient, abusive during intermittent fever, has helped to unlock the whole thing, and it helped us to prescribe a right remedy. So that is very, very important in taking up this particular condition and case. Now, at this point, I would ask Dr. Shobha, I would request Dr. Shobha to share her case one. She has one case with her, and I will join in 5 minutes because I have reached the hotel. So you mind where I am in Jaipur traveling. I just reached so that I will be comfortable to log in, right? Dr. Shobha, please take over and share your case.
Okay, Dr. Praveen sir said, I would like to describe one case of mine. Like it is a case of an elderly lady. She must be around 75-year-old, and she met with her. She met with a fracture. She fell down once, and in her house itself, and her neck of the femur was fractured, and she was taken to a hospital for the operation. So after operation, what happened that her daughter, she noticed some changes in the patient in her behavior, and she called me, that okay, she is observing something in the behavior of the mother. Just a minute, I'll stop share this. That the patient, the daughter said that she observed some very different type of behavior in her mother. So she told me to visit the hospital, which she was not able to understand. So she called me to the hospital. I went and I saw that what was happening was that this patient, like, when she was either talking or eating or, just sleeping or just even not even conversing, anytime, what will happen is involuntarily, she will just come out and she will speak one sentence. And she will again come back to normal. But when she speaks this sentence, as if she's speaking in a trance, as if she goes into that trance or she becomes blank and she's talking the sentence. So, and most of these sentences which she used to talk was about her mother. Now she is 75-year-old and her mother has passed away very long back. But still, like, she would say that, okay, call my mother, or where is my mother, or you take me to my mother, something related to, like, but most of them were related to her mother, or where am I, like, something. But she's talking and she would go into that trance, she would become blank, she would say that sentence, and again she will come back to normal. So this was the behavior which was observed by the daughter, as well as I also observed when I was present over there, that these things were happening and she was repeating this. So this was very characteristically, like, what I felt was that this is what was the state of a delirium. Whereas what is delirium? Delirium is that when you are going on one track, suddenly your train is becoming derailed. Your thoughts are becoming derailed. Your mind is becoming derailed. And then you are again coming back on the track. So her mind and her thoughts used to become derailed. She used to have some thoughts. She used to speak something, and again she used to become normal, as if nothing has happened. So this is what used to happen. And otherwise, like, this lady, she's a very positive lady. She's a very strong, will-powered lady. She used to live alone in Mumbai, and her daughter and son both were living in the other cities. But like, she was living very happily by her own self. Earlier, her husband was there, but after her husband passed away, she was living happily by her own self. But at the same time, she was very angry if things do not go do not go as per her wish, and she would get angry, and during the anger her language would get rash, and she would also be sometimes abusive, and she can talk something very abruptly. This was also observed. But this peculiar thing, of her behavior was something which struck me, and which I felt that this is very important. At the same time, it was delirium. The peculiarity was seen in delirium. So, friends, when we are getting this type of peculiar things, peculiar symptoms, and that too, which are there expressed at the level of the mind. So then I tried to go through, and I had come across, I knew about this rubric while studying the remedy earlier. So we have one rubric in our mind chapter, that delirium repeats same sentence or words. And it is a single remedy rubric, and there is only single remedy camphor in it. So, and see, when we are getting this, definitely the single remedy rubrics are utmost importance, because it takes you very much nearer to the patient. So then, but also we need to match the other totality of the patient. So when I tried to match it with the other totality of the camphor was matching with her personality and the other things, and I prescribed her camphor. But my main base of prescription and the entry of prescription was through this single remedy rubrics, and it worked wonders. And all this delirious talk, that whatever was coming up from her had disappeared beautifully. So yes, friends, Dr. Praveen sir is here. Thank you very much, Praveen sir. This was the case. I would like share your PPT again, sir.
Yeah, please. It was wonderful. That case also, what you have narrated, wonderful, fitting into this groove. Now we'll move on. So, next, please.
Yeah.
So, we need different types of approaches. When there is no much characteristic features available in a case, nor any guiding features for us, but there is only one peculiar symptom, one characteristic symptom, one symptom. If that has an answer, most of the times this keynote will have only one drug. Most of the time, it is not always, but most of the times. Then definitely it would be very, very useful in our clinical practice. Next, please. So, we need to take care of these things very importantly. We cannot be overridden by importance of keynote and saying that this is the only way we have to prescribe. Har dafa jinda tirasmat kaam nahi karega. We may have to take mental symptoms. We may have to take family history, personal history, past history, many things. Every single point would guide us to select a right remedy, all put together or singularly. So we need that. We need different types of approaches. That was my important point, which one I wanted to tell you at the very outset. But one of the approaches is keynote. That, next please. So, a patient can be successfully treated by prescribing a particular drug on the basis of a single, peculiarly revealed by them. Peculiar. It's very important, like a single drug, peculiarly revealed. What is that important? Like peculiar, the peculiarity is very important. Okay. So all drugs have some unique, singularly peculiar symptoms. What I am talking is about the drugs, because I have just spoken about the single drug rubric. This is also similar to the keynote. Keynote in a prescription in a patient and a single drug rubric in the repertory, they are similar, though not the same. Because if you have, like for example, I'll just give you an example. Biting child, the child who is having the habit of biting. There is one drug, which is belladonna, which has got 3 marks. You can't brush it aside. This has so much of importance. There are so many things which are given even in Kent's repertory, though of course, as a principle, Kent was against basing completely on single drug rubric or keynote prescription. He was telling you have to dwell more. Even the Hahnemann's teachings were also speaking that if you say one-sided or if you say there are no characteristic features, it is a mistake of the physician rather than the mistake of the patient. You have to dwell a little more so that you can extract more information, more symptoms. That's what they have been telling. But if it, in case there are paucity, then naturally you have to depend upon. Next, please. Some single drug rubrics, as an example, I was just biting in children, belladonna, as an important remedy. So likewise, there are quite a few. This is one example page which tells these are all the rubrics which are already given in Kent's repertory itself. Next, please. So when not to use single remedy symptoms for prescription, as we are talking of keynote equivalent to single drug rubric. Now, single remedy rubric or that type, you can say in other words as keynote. When the case is clear and complete evaluation is available, don't use the keynote, don't use the single drug rubric. When case is clear and definite totality for the simulum is available, dwell upon that, depend on that rather than just single. But it can give you a way, like as Dr. Shobha in her case explained clearly, that she has come to conclusion of a remedy basing on all the available totality. But the entry point was this single drug rubric. So it can help you. When vitality is high and clear expressions are available, don't depend on single remedy rubric. When pathology is not very advanced, or when peculiar symptom is in low intensity, or it has not been verified or confirmed clinically, then obviously you have to search a little more. Are there any other characteristic features available in this case? That's very important. Next, please. Now, if you see 153rd aphorism of the organon, our Krutik Shah is master in, because he is the only son of Hanuman. We don't know who were the children of Hanuman. I only know Krutik Shah is the only son of Hanuman. So the more striking, singular and uncommon and peculiar characteristic signs and symptoms of the case of disease are chiefly and most solely to be kept in view. Hahnemann mentioned very clearly these PQRS or striking, singular, uncommon, you should be able to catch them. I keep telling one saying in English, what you don't have in your mind, you can't see it outside. So you feed it to your mind that such a type of peculiar symptoms can exist in materia medica. After all, the materia medica came from the people. So again, sick people are telling you. And the people who proved they became sick and told you. So that's how that is a relationship. So that is how it is very important. Next, please. Keynote. Most of us would think of another name. That we will come to that. But actually, the concept was first used by Dr. Jacob Janius, American homeopath, but he could not coin it as keynote. He could not coin it as, but only Dr. Guernsey. He published his renowned and very important book on materia medica, which you call it as keynote to the materia medica. Now we have got Allen's keynotes, which is world famous among homeopathic fraternity. Okay, next. So who is this Guernsey? Henry Newell Guernsey was, in fact, very important, who coined this keynote word to the keynote symptoms. He actually gave a new name for old Hahnemannian idea. It is there already. Hahnemann mentioned it as new, peculiar, striking, singular. He just named it differently as keynote. Next, please. So Guernsey was professor of mathematics in Hahnemann Medical College, Philadelphia. I had the misfortune of seeing this Hahnemann Medical College, Hahnemann Homeopathic Medical College letters on the big general hospital in Philadelphia, but not even a single homeopathic doctor works in this hospital. It is very unfortunate. Anyway, so this man worked in 1871. So this was criticized by Kent. because he said the great trouble with keynotes is that they are misused. This quite often happens. But if you can extract a keynote, you cannot misuse it. You can't construct a keynote out of thin air. You can't. The patient has to tell you this is the characteristic feature. You should be able to understand that this is the symptom which is actually surrounded by all rest of the points. It is in the center, central focus. So the keynotes are often the characteristic symptoms, but if the keynotes are taken as final and the generals do not confirm, then will come the failures. It is very obvious. Generals are highly important. According to Kent and according to our own practice, generals have to be satisfied. Kent has given some characteristics in lectures of Mathemedica himself. For example, now if you see, he himself mentioned some of the keynotes like phosphorus, in low fever, wants to be mesmerized, lycopodium, deep furrows in forehead and face with flapping of nostrils. When you look at this patient, you'll get only lycopodium. You don't get any other drug. That is what like the characteristic features. Camphor, vomiting and purging with cold, blue, dry skin. Who else has in our Mathemedica? When you touch the skin and it is so cold and the fellow is having acute gastroenteritis, you will think of only camphor, nothing else. Cuprum, sudden blindness followed by convulsions. No other remedy. So, what is the keynote? It's an instrument by which something serves to disclose or open or solve something. This itself tells you the whole definition of keynote and its importance in our clinical practice. It's an instrument, I repeat, please, by which something serves to disclose or open or solve something. It also helps to perceive the level of intensity or artistic execution. That's very important. It helps us. Now, what are its characteristic features? It is a predominating symptom. It helps to direct our attention to the totality. As Dr. Shobha said, like she has selected the remedy basing on keynote and substantiated by other totality. Substantiated. When the prescriber becomes familiar with these keynotes or characteristics of remedies, he will be able to find more quickly the remedy in a given case because the field of selection has been narrowed. Most often than not, we, maybe erroneously, maybe prejudicially, maybe out of stereotype prescription, when a patient comes and tells even a little movement causes the pain, you think of only bryonia. There are other drugs as well, but you don't think of any other drug because it has almost become its keynote. So we immediately get that type of drug. There is some problem. You should not be carried away. But we try to select bryonia basing on other, like you ask the thirst, you ask other, the dryness, other things as well. Okay. So when he recognizes such a keynote in the symptom of a case, it suggests or recalls to mind a medicine having a similar keynote. A reference to Repatriation and Mathemedica will verify and complete the comparison. There is usually something peculiar in the case, some striking combination of symptoms that directs the attention to certain drug. And this is what Dr. Guernsey called a keynote. This is very important. It's synonymous with Hahnemann's characteristic symptoms. Next, please. A characteristic symptom or a keynote is a generalization drawn from the peculiar symptoms by logical deduction. You know the logic, inductive logic and deductive logic. Here, deductive logic is used. So they cannot be determined until a complete examination of all the symptoms of the case for the purpose of comparison. It's very important. Next, please. So keynote generally falls under following categories. The categories are very important. It is a very peculiar symptom only to this patient. We have not seen in any other patient. Mental concomitant with bodily disease, it could be, as I just narrated, a boy who was becoming abusive when he has throat pain. Precise locality. If a patient tells he has got renal colic left lumbar area, you will think of Berberis vulgaris. If it fails, then only you will think of other drugs. Course and direction of pain and sensation. If the pain from a particular area to a particular area. Like even the same example of Berberis vulgaris, where it started in the loin and has gone to the groin on the left side most often. Then you think of that because it is the course and direction of pain and sensation. And some of the alternative symptoms, rheumatism alternates with gastric symptoms likewise. Then the modalities, very important, new moon, full moon modalities, 1 to 3 a.m. modalities, 2 to 3 time aggravation, some modalities, whatever, maybe amelioration as well. So they will tell you this is the keynote. Next, please. Then how to use these keynotes. The proper knowledge of keynote symptoms of medicines and applied medica is very, very essential. It's not that when the patient comes, you select a particular symptom and say, this is the keynote. And then you select it in repertory and prescribe. It should not be. You should have some knowledge of these keynotes in your brain, according to materia medica knowledge. And then you should be able to search it. Then the second one is the possession of techniques to get indications from the patient and erect a totality of symptoms. This is very obvious, very compulsory equipment needed for any homeopathic physician. Even to my new neophyte homeopaths, this is very essential. We need to have how we can erect the totality. Next, please. Now, we'll see the case number 2, which is very famous from my point of view for keynote prescription. A 43-year-old, menorrhagia, black blood, menses every 30-35 days, lasting for 20 days, and mild pain lower abdomen. Then does not want to talk to anybody, sad almost always, sleeplessness, ambit to chilly, moderately built, anemic. These are all the things. It was diagnosed as menopausal syndrome or dysfunctional uterine bleeding. You know its diagnosis, dysfunctional uterine bleeding, in spite of all the investigations done, which are all negative. The patient is still continuing to have menorrhagia-like symptoms. Then you say it is dysfunctional uterine bleeding. So already two homeopathic doctors, seniors to me, use Sepia, Pulstilla, Thalaspi, Millifolium, Ferrophos, lecithin, and other drugs as well. The lady was advised to undergo hysterectomy by 3 gynecologists, which is obvious. But once what happened, I have given Calcarea basing on the symptoms. And after Calcarea I told her you will be all right tomorrow. I gave in 0/1 potency, thinking all the other seniors wouldn't have given in 50 millismol. So I am the master in it. So I thought I have given. But next day evening, she came and slapped on my face and told nothing happened. No relief. So then I thought there is something wrong. But I was adamant. My prescription was right, I thought. I gave 0/3. Next day evening, again the lady came. No relief, no change. What to do now? It is definitely a slap on the face. So what to do? I sat with her and told her, this is the greatest problem. We all know. Seniors would agree with me. The juniors would experience later. When you have tremendous time, there are very few patients. When you have too many patients, you have very less time. This is the problem. The disparity continues all the time. So then I said, okay, let us forget all the other people. Let us sit with this lady. I probed and asked, why? What is the problem? You please tell me what happened to you? You tell me. You tell me. She said, I told everything, sir. I told everything. And you are asking again and again and again. So I think there is nothing serious. I have explained everything to you. Okay, sir. Now, as you are asking, probably I would think then she, as a passing remark, as I already said, she said she does not use pads. Then I said, come again. Yes, I don't use pads. You are a lady? Do you be? You don't use pads. I asked, do you use cloth? No, I don't use pads because I get bleeding only while urinating. This is a very peculiar keynote symptom of this patient. Now, you should have a drug for this. I never heard from any patient hitherto, and I never heard any drug having this symptom. Immediately rushed to Robin Murphy on my table, and I have seen female chapter rubric menses urinating only when. Only one drug in third grade that is there, which was Magnetus polus australis. I have given this 31 dose and gave 11 doses SL. Next day morning, 11 o'clock, she gave me a ring when I was in the college and said, Sir, now she told, underline that remedy. Since morning, I have gone to the toilet 3 times. I never had bleeding. So, this is the keynote. I wouldn't have even dreamt in my deep dreams also about magnetos. This drug is there in my medical chest because we use for ingrowing of toenails. It is not for female, never ever I used. So this was confirmed. My friend Dr. Krishnamurti also, he also had a case. And in fact, I thought this is not there in any source book because I verified hearing guiding symptoms and I verified uh, Metromedica Pura, his own drug, his own book. It is not there. I thought it is not there. But one friend in Chennai wrote to me a card. He said it is in 1548 or 42 page of Allen's encyclopedia. This symptom is there. My God. I should really appreciate that gentleman. Hats off to him. So this is what like the keynote. It cured. She is still in touch with me for her daughter's problem. She never had any problem after this drug. Wonderfully, actually, this has almost cured her complaint and made her completely all right. So this can also happen. We don't know. We need support of other cases also to say that with keynote, if you prescribe and cure one condition, the patient becomes completely all right. We don't know. We have to have some more information. Next, please. So case number 3, 71-year-old lady. In fact, Dr. Shobha and all my friends in NJH have already told only cases to be discussed, not the theory. So I struggled hard to collect all the cases. Now I'll try to share all my cases with you, right? 71-year-old lady with endometrial carcinoma, having severe pain abdomen, diffuse, not relieved by any analgesics. Already chemotherapy and radiation was also given. Hitherto, the disease was progressing. Obviously, it's a carcinoma. It would not stand still. Unmarried lady had some responsibility, took up, and then she did not want to marry. Conium did not give relief. Cancer, unmarried lady, I thought conium is the remedy. So I prescribed no much relief in pain abdomen, severe pain abdomen. She has a peculiar modality. Her caretaker lady told, whenever she has pain abdomen, I give her coffee, filter coffee, and she's relieved. My God. So I searched in the repertory. Pain abdomen ameliorated by coffee. Only colocynth is there. We know colocynth relieves pain. Colocynth binding double relieves pain. Pressure relieves pain. But coffee also relieves pain is a good thing, new thing. One drug, single drug, keynote helped us to relieve her pain. She was on colocynth 0/6 infrequently. In fact, this lady very recently expired without any serious problem. We could not, we cannot claim that we have cured with colocynth. We have palliated, gave her relief. The keynote has helped her to have alleviation of her pain for quite some time. Next, please. So, case number 4, 21-year-old girl with severe dysmenorrhea on first and second days. Menses regular with normal flow. All the other personal characteristic features were normal. There was only one peculiar symptom. She takes alcohol for almost 3 days before the onset of menses. And is forced, she is a very hi-fi girl, hi-fi lady. She lives in a very posh locality. Her father is, I think, DIG or something, and very disciplined family, DIG family. I'm not against police people, but that's how they are all like mod, very mod. Mother is a social activist. So, for almost 3 days before the onset of menses, she takes alcohol, and she is forced to take on the first 2 days of menses because of pain. But pain is not relieved by taking alcohol. Mind well, she takes alcohol. Somebody told, some of our friends told, you take alcohol, you will be drowsy, it will give relief. So she takes before menses, she takes during menses also, thinking it gives relief. She became all right by selenium 201 dose 1 month, every month, before menses for 3 months, depending on only one keynote. Decides alcohol before menses. Never ever she takes alcohol. After the menses, she doesn't touch the alcohol. This is something peculiar. Well, actually, I usually ask my patient, do you have any good habits? Because why should we call it as bad habit? Because we don't have that good habit, why should we call it as bad habit? So she said, I don't have any habits, but I take alcohol. So this is what, like, and she was insisting she takes foreign scotch. Now, the case number 5, 36-year-old software engineer was operated upon for fistulectomy and sphincterotomy. Anal sphincter was also operated upon for correction. Pain in anus area and operated area has been so severe that he was always mentioning about his imminent death. I would most probably die with this pain. There are quite a few remedies which have got this type of description. One of my patients came to my clinic and he said, Doctor, please do something. I don't have time. Please do something. In fact, he jumped the line, token number, and he came in requesting others. He had severe pain in the right lumbar area, renal colic, severe renal colic. And he said, Sir, I have got only half an hour time and I can't reach any corporate hospital. So it is your nearby clinic. I came here. If I am not treated successfully in half an hour time, probably I may die with this pain. Please give me some drug. Please give me. This was the thing. So the drug, all of you would have guessed it correct. I have given a aconite to that gentleman with that type of fear of death. But for this fear of death from pain, there I have given aconite because it was predicting the time. Exactly. I have only half an hour, I would die. And lot of anxiety. He was eating my brain. He already ate so many brains in the waiting hall, and he came in and he was eating my brain as well. So I have given aconite to that fellow. But here, fear of death from pain. With this pain, I might die. It was not with severe anxiety. The expression is also important. Coffee was given basing on only repertorial prescription, and it gave much relief, and it relieved his fear as well. Next, please. A man aged 46 years came to the clinic with a diagnosis of recurrent fungal sinusitis. There is one ENT surgeon in our Hyderabad who does operation to everybody, whoever comes with ENT problems. If he has not operated upon anybody, that fellow should really do some special seva to Lord Venkateshwara in Tirumala. That is his good fortune. This man diagnosed it perfectly as recurrent fungal sinusitis. He already operated upon that gentleman once, but it is recurring. He said, it is recurrent. I'll give some pain. There is one, Dr. Shobha, you read, there is somebody is saying fear of death with pain. Okay. Now, he was already operated upon once. All the symptoms of cold, like severe sneezing, more in the night, pain in the cheeks, loss of smell, nasal obstruction. These are very common for fungal sinusitis. The man has already stopped many food items because he was also advised you have some terminate hypertrophy a little, so it could be allergic manifestation because of which the fungal sinusitis is recurring. So stop this, that. Some list was given. He also has the frequent epistaxis. That was also there. Patient was more towards chilly. Recurrent fungal sinusitis, more towards chilly. I have given arsenic amalgam 0/1 for 15 days. Said you will be all right. There was no relief. I gave tuberculum 1 dose, followed by arsenic al 0/3, which is a common prescription which I have been following, and most of the patients do get relief. What if the patient doesn't get relief and comes back? Then we will have a review and we will think somewhere we went wrong. So when reviewed thoroughly, he mentioned sneezings wake him up. When I was asking him, मैं जब भी सोता हूँ मुझे चीख आके उठना पड़ता है नींद में से एवरी डे. नींद में से उठ गया बोले तो चीख के वजह से ही उठ गया, वैसा होता है मुझे. So this peculiar symptom was there in ammonium more. It is also one of the beautiful remedies for coryza, sinusitis, all these symptoms. So 1 month we have given, later Saclac for 3 months. The patient completely relieved of his complaint. He's absolutely all right. He is still in touch with me. He doesn't have any problem. Case number 7, 36-year-old software engineer, dyslipidemia. You can see the report as well. Discovered on routine checkup. Nowadays, it is very common. Most of the patients do go for investigations once in a year or once in 6 months with a lot of fear, apprehension, and all that. The other day, one patient was telling, sir, we were caught unawares by COVID because we were not careful and we were not undergoing any investigations. I said, what test you would have done for COVID before COVID came to you? No, at least we don't know. All the other investigations would be normal. How do you catch COVID beforehand? You can't. So I keep telling all my patients, my common slogan is don't suffer before suffering. When it is a time to suffer, suffer. But don't suffer before it. Anyway, it was discovered on routine checkup. He did not have any symptoms. He was already using statins, but due to fear and no relief, he came to us. He had one peculiar symptom. Severe distension of abdomen after milk only. He can take coffee, oily food, chene ke dal, which is commonly gaseous in most of the patients. Nothing happens. Only when he takes milk. So I thought some magnesium group of remedies. But anyway, let me check. When I have seen only conium is the remedy. So I have given 0/1. Next report came, and that next report showed absolutely normal or better lipid profile. So then ammonia more, yeah, confirm. So now 14th report he was put on SL and yet the report remained normal. Because I wanted to discontinue the remedy, see how far the patient becomes all right. And when the report still continues to be normal, I stop my medication. There is no point. I will only tell him once in a year, get your lipid profile checked. That's it, nothing else. Next, please. Case number 8, 28-year-old male complaining of severe pain left elbow since 1 week. This case I have presented in my NJH webinar once. Okay, there may be 1 or 2 cases which have been repeated, but please bear with me as it is a stopgap arrangement I could not procure because I am in Jaipur. Okay, done. Now, drawing, pulling, cutting, and can't explain. He said all 4 varieties. When I asked, usually we ask, how is the pain? It is very difficult. There are 108 types of sensations of pain. So it is very difficult to put it into the slot. If once you get the pain, you just imagine what type of pain you have. It is very difficult to. One of the patients came and said, "Bahut meetha sa pain hai." I wondered. In fact, that is also there as a rubric. So we never know these things. Anyway, this fellow told even he can't explain. There are sometimes where he can't explain the pain, how it is. Aggravation evening and night. Tried applying hot fermentation on the advice of the doctor, but it increased the pain and caused him lose the temper on his roommates. When the pain increased, he lost his temper. His roommate himself said he is a very nice gentleman. Software engineer, work from home, getting irritated easily, feeling depressed as the pain is unabated. X-ray NAD. My sir used to say, if you see so many NADs, you will become MAD. That's what it becomes. Elsewhere diagnosed as tennis elbow. We have got golf elbow on the opposite side as well. When we tell this diagnosis to our patients, the patient tells, I never played tennis. Doesn't matter. So GC fair, diabetes, hypertension, thyroid dysfunction are not there. Next, please. 1 week back, his bike failed in the night and he had to leave it at the mechanic shop and walk down a kilometer with a 15 kg grocery bag in left hand and curd tin in right hand. That curd tin was a little fragile. It might spill over. So, young man, young boy, so he felt this 15 kg he can carry with left hand. That was the history he gave me. When I probed, what happened, why did you get it? Next, please. From next day onwards, his pain in left elbow has started. It should be Rustox or Calcaria. We can give. But if you see pain elbow after carrying weight, only one drug, chamomilla, it was given in 200. It was substantiated by irritability. He is irritable. But most of the times we ignore that irritability. With pain, everybody would be irritable. यार छोड़ो, तुमको दर्द आए तो तुमको भी मालूम हो जाता है. गुस्सा आता है नहीं आता है. तो वैसा. So we take it for granted. But when I have seen chamomilla in the repertory, then my mind said, Arey yaar, you missed that irritability. So I have given chamomilla 200, 3 hourly, 6 doses. Pain completely subsided. Never required any other remedy. Next, please. Case number 9, 16-year-old young 10th class boy was brought with the complaints of diarrhea since 3 days. Watery, offensive, always preceded by severe colicky pain in lower abdomen. Pain slightly ameliorated by passing stools. Loss of appetite, thirst increased, feeling weak. So we will think it could be arsenic, podophyllum, likewise. He used allopathic medicines for 2 days, no relief. Commonly they go there. One peculiar symptom, which is slowly revealed with a lot of doubt, was that every time he smoked a cigarette, he would develop severe pain abdomen and it would end in loose motion. This boy, a small boy, was forced by his classmates, friends. So he started developing this smoking as a habit or as a fashion or something like. So, but that caused this problem. Whenever he smoked, he developed severe pain abdomen and then it would end in loose motion. This he narrated later and he told this could be the reason why he has been getting pain abdomen and loose motions. And he has been indulging in taking so many tablets. Some names of the allopathic drugs also he revealed. So one day he was getting some relief, the other day he was not getting relief. So he was forced to start smoking 4 days back. Diarrhea after smoking, borax is the only remedy. ORS was also advised. He became completely all right. Only 3 doses. We have given 2 early. Everything became completely all right. It's an acute disease. We don't need to bother much. The patient is in the nearby vicinity. If there is any necessity, he would come back. Next, please. 26-year-old lady, sad, morose, and not talking to anyone since a week. This is the presenting complaint. And sad, morose, and not talking to anyone, common for many. Should we give much importance? Yes, it has to be because it was stressed upon. And when a patient seeks medical relief for this complaint, it's very valid, very important. So looking dull, sitting at the corner, and brooding all the time. Loss of appetite, no thirst at all, constipated. This is all like depression type. No interest to do anything, sleepless, not interested to go to the office. Applied leave for 2 weeks. She's unmarried. Is that the reason to be morose? Should not be. She should be more happier. She works as steno to the MD of an MNC. She is non-diabetic, non-hypertensive, and youth head. It all started a week back after she had nasal bleeding in the evening after coming from shopping. Can anybody imagine that once you saw blood from the nostrils and you become sad, depressed? It can happen. Many people, you can see, like, though not this lady, there are many patients who would come with such type of hypochondriac nature. They would think, imagine, they will have. I'll quote one example how these imaginations would go, but it will also give you one lesson as well. Most of you must be aware of Dr. Deepak Chopra, very world famous Dr. Deepak Chopra, an Indian by name, religion, everything, but settled in the US. And in 1996, when he came to Bombay to deliver lecture, his delegate fee was in thousands. You can imagine at that time, right? Now, this Dr. Deepak Chopra, when he was practicing, a lady approached him and told him, "Look, doctor, I have cancer in my breast," directly. So, doctor examined and said, "I am sorry, you don't have cancer. Don't unnecessarily worry about it." She went back. After an year or so, she came back to same Dr. Deepak Chopra. It is there in Quantum Healing, that book he mentioned. And again, she came back after a year and same sentence. Then same examination, same result. Dr. Deepak Chopra laughed at her and said, "Why should you worry unnecessarily? Don't think more. Leave it." For 3, 4 years, she did not turn up. Later, she came back to him. She told the same symptom. Doctor examined. Now he said, "Now you got cancer." And he writes, if you meditate upon a disease, you may get it. So we should not. Here, this imagination would land us in so many problems. We unnecessarily invite. Here, what is she thinking? With a little bleeding per nose, she is already depressed. Next, please. She never had such complaint. And after seeing the bleeding, she went to a corporate hospital where she was declared to be normal after all the relevant investigations. Yet she could not convince herself. Some lady wrote fear of cancer. That could be probably for that lady, Deepak Chopra's case. Now here, depressed after bleeding from nose, only one drug, Ulcertil. I wouldn't have imagined that depression can lead to, can come or spring from nasal bleeding. So 1 dose, 1 ml, SL11 doses, fourth hourly, completely all right. No depression, no problem. Again back to smiling, again back to work. Nothing happened. She never needed a second dose to be repeated. She became completely all right. This is the power of this keynote, if I can catch it. And there could be, when I am sharing with you my 10 successful cases, it means there are 100 unsuccessful cases earlier wherein I could not catch a keynote. I have failed. I would have taken the case, I would have prescribed basing on only common symptoms, and I would have unheard or did not give any attention to a keynote. So the essence is, what do we need? Lend your ears to the patient. Patient tells you the characteristic symptom. Don't leave it. Catch it. And then you would be highly successful. Next, please. So case number 11, 25-year young boy. Roommates brought him for severe giddiness since 2 days. In our clinic vicinity, there are so many coaching centers for civil services and groups. So many aspiring young people would be there in and around. So he is preparing for civils and staying in the hostel. Commonest question I ask these aspirants: why is it called civils? Okay, this is the question to all my webinar friends also. Think about it and have an answer. Okay, why is it called civils exam? Right. Now he is interested in astrophysics. Next, please. And he purchased a small telescope and on 21st June 2020 watched sun and solar eclipse for almost 6 hours from the terrace. Next, please. Vertigo started since then. He was not able to see the sun or sunlight, lest he may develop severe giddiness. If you look at sun, you will get. So, should it be bryonia? It may be. Natramur, sun exposure. Natrum carb, heat exhaustion. Glonine, any problems in sun weather, heat weather. Agaricus has got that similar set of symptoms. Should we think of these drugs? I was thinking. Glonine, somebody wrote. So many. Actually, the vertigo started after looking into sun for long hours. What did we say? Vertigo on looking at sun through the telescope. What was he doing? Not just exposed to heat, not just exposed to sunlight, but looking into sun for almost 6 hours, maybe in between some gap. He was interested. He was trying to watch before, during, after eclipse. It took a long time for that eclipse, and it took away his, in fact, health as well. So Califas is the only remedy. Vertigo on looking into sun for long hours. 3 doses too early, completely relieved. But these guys will give for a day or two, and Califas we have given, and he became completely all right. Charles Raw, when we have shared 11 cases, there's a little more to share with you. Some of stalwarts expressions about keynotes. You would have got bored about all cases. I don't think so anyway. You should be interested. Now, Charles Raw, Raw's pathology is also there. Characteristic symptoms individualize both disease and the drug. This is very important. We know it. It belongs exclusively to a single remedy, and caution not to diagnose a remedy on one symptom only. That we have been telling from the word go. Be it ever so characteristic. They define the circle of remedies out of which we must select. Obviously, now when I was mentioning Califas, there was another drug, but I have selected Califas. It helped. So there would be. Every stool must have at least 3 legs, Constantine Herring says, if it is to stand alone. Select at least 3 keynotes. And Herring, you just look at him. He tells us to select 3 keynotes. To select one keynote itself is difficult in clinical practice. But if we get 3 keynotes, nothing to beat it. You are 100% successful. It is wise to give the symptomatic stool a broad base and as many legs as possible. It is always wise. But we have already learned that keynote becomes very helpful when there is paucity of symptoms and when there are no characteristic guiding features for you. Next, please. So to conclude, single drug rubrics or keynotes are very useful in the selection of a correct remedy. But the generalities have to be given their due importance. When well-selected remedies fail, or we are not able to arrive at a right remedy, if the case has even one single drug rubric or keynote symptom, it will help in the cure of the case. We have seen in quite a number of cases. To collect keynotes from the patient, we must listen to the patient carefully. This is the most important aspect which you have to underline in your mind. Listen to the patient. Don't ever come to conclusion. If you have any questions, you're most welcome. Thank you very much for for your patient hearing, and I thank all my NJH friends for giving me this grabbed opportunity. Thank you very much.
Thank you very much, Praveen sir, for the wonderful, wonderful lecture, in so many cases. And it was like a wholesome lecture which talked about not only the little part of the theory, what is it that is very much needed, to when we go into the practice. That is what is the thing that you spoke about, when to take the peculiar symptoms, when not to take also. Like all that in a clear meaning wholesome thing. Wonderful lecture. I'm very sure that lot of us must have learned this PQRS symptoms of many remedies, and they must have had some cases from their practice also in their mind, which they would crack sure and short after your lecture. So let's see, sir, if there are any questions.
There are quite a few. I read it.
Yeah, sir, I was sharing the screen, so I wasn't getting at that time. Let me see. So one doctor is asking that if there are many important symptoms, then how to judge which keynote is important and select?
Fantastic question. Herring
Yes.
himself said like you should have at least 3 keynotes to prescribe. But all 3 keynotes, we don't expect them to be in one drug. This is very obvious. Practical difficulty point. Second point, if you have 3 keynotes, let us say 2 or 3 keynotes, the keynote which definitely covers the generalities of the patient, the keynote drug which covers the generalities would be the drug which has to be selected. The 2 keynotes. That's very right.
Yes, sir. Yes,
Right.
sir. The generalities also, if it is covering the mind also, where we see something abnormal.
Absolutely. Any generalities.
Yes, any mental or physical, yes. Even like, as what Dr. Vijayakar sir, Praful Vijayakar sir used to say, that you try to find out the syphilitic symptoms. In the sense, what is most abnormal in the patient. And if we are trying to get some characteristics in something which is most abnormal that he is trying to tell us, then also
Right.
that would come up as a characteristic symptom, and you give meaning your attention to that and importance to that. Fantastic, sir. What else?
Fear of cancer, somebody asked a question. Actually, that fear of cancer was Dr. Deepak Chopra's case. I have not treated. The lady had the fear of cancer, visited him 3 times. Third time, she was wished congratulations because she got the cancer. He tells, if you meditate upon any disease, you may get it. So that is to tell you that you should educate the patients not to suffer before suffering.
Yes, sir. Sir, most of them have said wonderful lecture and they've liked it very, very much.
One more question. What drug was
Interesting
given
cases.
for nosebleed? Pulsatilla was given for nosebleed patient. Depression after nosebleed, Pulsatilla was given.
Okay. Yes, sir. I can't see any other questions. I think that is all. I can't see any other. Sir, for the Califos also, some doctor is asking which rubric you took for Califos.
Califas, vertigo on looking into the sun for a longer period.
Right. There are some questions coming up, sir, now. If you get keynote E symptoms in acute exacerbation of chronic case, what to do? If you get keynote symptoms
Depending on
acute
what
exacerbation of chronic case.
That's what we do when there is an acute exacerbation. We depend on the acute totality and prescribe the remedy according to that totality. If that totality is showing one keynote and that is leading to a remedy, prescribe it. The patient's acute exacerbation will come down. Then its satellite remedy would only be there in the list to treat that patient completely. If you see Borix Mathematica, there are drug affinities chapter. Under one drug, there are so many drugs which are given. Like if this drug has come up as an acute exacerbation drug, the other drugs which are listed there, they would be among the drugs which would be in patients' chronic condition. That of course again depends on the totality, other indications, and we prescribe. So whatever the keynote indicates you to prescribe, that is the remedy.
Sir, another question is, if patient says rubbing chest ameliorates her cough, so we should take it in chest chapter or general rubbing ameliorate?
Rubbing chest.
If rubbing the chest
Rubbing chest.
ameliorates cough, so should we take it in chest chapter or general rubbing ameliorates?
When it is rubbing chest, ameliorating what?
Ameliorating cough.
Which symptom?
Cough.
If it is ameliorating cough, you should take that, not the generality. If the whole body is getting ameliorated, whole personality is getting ameliorated, then that is generality. Or the patient feels comfortable mentally, then it is in the mind.
Yes.
So it depends on which part of the body is affected, which part of the body is getting relieved. That chapter should be looked into.
Yes.
Because same symptom we see in several chapters.
Fantastic. Okay. Sir, any rubric taken for that lady was thinking about disease conditions, then what it would be?
For which lady?
Any rubric taken for that lady was thinking about diseases.
Acha, that is, she has the one. Already it was mentioned by other friend that fear of cancer. I have cancer, please check. Many patients do come. Fear of cancer, if you see the rubric, there are few drugs like carcinosin, arsenicum album, arum metallicum. These are the drugs which are already there in repertory. Fear of cancer. So we can select basing on other characteristic features which are available.
Right. Sir, another doctor is asking, if patient complains as soon as he wakes up, severe sneezing started with nasal, what would be the suggestion for the rubric or medicine? As soon as he wakes up, he gets sneezes.
Yeah, sneezing after waking up. It is there as a rubric. Sneezing
Yes.
after waking up. Many patients do tell us. We select basing on that, the rubric.
Yes, you can see this in the nose chapter.
Yeah. Nose sneezing, we can say.
Yes. If you are getting excellent results after single medicine rubric or LN keynotes, what does it indicate? Is it your similimum or just a state remedy?
Similimum or?
State remedy, which is covering that state.
Obviously, it should cover the whole personality to cure the individual. The keynote is only a way to reach it.
Yes.
As I tell you, if I have started from Hyderabad to reach Bombay to meet Vishpala ma'am, okay? Now, after coming out of Hyderabad, there will be a directional board, Bombay for 25 kilometers. What does it indicate? If you travel on this road for 25 kilometers, you will reach NJH Vishpala ma'am. So that is the road map. Keynote is a signpost. It is telling this is the way. This is the right way, right path. Now you will get it. It might completely cure it, or it might completely help you to select the right remedy in the process and cure the individual. As Hahnemann clearly stated, that it is very difficult to cure an individual with one single drug, single dose. He did not say it is impossible. He said difficult. And there you need to have Many other drugs follow-ups. He also said, like, first you take like complex miasmatic. Nowadays, difficult to get one single miasmatic personality. So then he says, first select what most prominent, then select another, then select for antisoric remedy. Likewise, he has given the pathway. So this miasmatic pathway, when he is mentioning, he already said that there are quite a number of cases wherein you may need to select a course of remedies. So the keynote might cure it or might pave way for other remedies to follow. And the patient would be able to tell few more characteristic features of the patient is getting relieved. He would tell because it was masked, it was suppressed.
Yes.
Now the
Yes.
drug will bring it out onto the surface. The patient now realizes, yes, I have this symptom, this symptom, this symptom. Now the drug selection would be easier. So
Yes.
that could also be there. Like a
Yes.
nose road which uncovers.
Yes.
Similarly, a keynote would uncover, will
Yeah.
help it.
Yes. The patient susceptibility is improved, and with that
Of course,
improved
of course,
susceptibility, the
perfectly,
body
perfectly,
expresses the characteristic symptoms.
perfectly, perfectly.
Yes, sir. Yes, sir. So there is one question: which repertory to follow for keynote? Sir, shall I answer this question?
Yes, please.
Yes. So, friends, what I would suggest is, nowadays most of us are having access to the softwares, the homeopathic, and it is easier for us to repertorize or go through the repertory, all the chapters of the repertory, extract the remedies, the symptoms. So, what you should do is, after going to any remedy, you extract the single remedy rubrics of that remedy and try and study those single remedy rubrics of every remedy or every case that you are trying to solve, even though you have solved it on some other symptoms. But when you have solved that, or when you want to study that remedy, you solve or extract the single remedy rubrics and study them. Yes, sir. Anything
Yes,
else that
yes,
you want to?
yes, yes. There are few more questions which we have to
Yeah.
answer. Now,
Yes, sir.
apart from that, for the friends who are little illiterate like me, who cannot use computer, and who are difficult, are lazy fellows, or who are not having much time, there are so many people, friends like me. For them, I would suggest what I use, Robin Murphy, which is like alphabetically arranged, which is easier, lot of symptoms. It is the collection of many repertories. So it is easier and then worthwhile spending little time on repertory and select a right remedy. There are a few more questions, Dr. Shobha. I have just read them.
Intermittent prescribing is forte of Bengal. What is of Hyderabad?
I
Sir,
say.
what is of Hyderabad?
Okay, right.
Sir, please suggest book for keynotes other than
Allen's, nothing to
Allen's.
beat. Nothing to beat Allen's.
Okay. You also said about this repertory. So you listed alternative symptoms in the list of categories of keynotes. Did you mean alternative or alternating? If alternative, please explain what it means.
Alternating symptoms.
Alternating, right? How to decide
One more
doses
question.
after selecting or on keynote symptoms. Sir,
What?
again, how to decide the doses after selecting the keynote symptoms.
Always please remember, my friends, my close friend Dr. Ajit Kulkarni wrote a small book also on posology, and Stuart Close writes extensively, perfectly. Now, higher the number of characteristics, its weight, higher the potency. If you're sure of your symptom, it is the drug. It is the drug which is covering the most important symptom in this patient. You can give it in the highest potency, whatever you want. If you are little unsure, then give lower potency, maybe 30, maybe 200. In many cases, if I have shown their keynotes, I have given either 30 or 200. Very rarely I have given higher potency, because even I was not 100% sure, because I read that rubric first time. Now, second time, if the patient comes to me with the similar rubric, I would give a higher potency. I will not munch, or I will not go back. So that's what, like, the prescription potency depends on the weight of your characteristic feature, not only the number, its weight, its depth. Praful Vijayakar and Rajan Shankar and both of them used to say the depth of that symptom and how much deep your drug can go deeper into that symptom, that matching. If you are able to match it, you can give higher potency. It should match.
Yes. Yes, sir. Sir, another question. Keynote symptom in cases of fever, when the symptoms are masked by allopathic medicine, patient is unobservant.
Yeah, well, there is no question of keynote, no, they won't give. But there is one rubric where in Metrimetrica it actually symptom is given. If the intermittent fever or fever cases come to you from allopathic spoiled like hands, then you can think of arsenicum album. If they come from homeopathic hands, give sepia.
Yes. So there are two questions, I don't think. The concomitant symptoms and keynote symptoms, how to differentiate?
Somebody asked repeat. Yeah. If the patient comes from allopathic hands and you are not able to select a right remedy, give arsenicum album. If the patient comes from homeopathic hands and you are not able to select a right remedy, give sepia. It is given in Kent's Metrimetrica.
Okay. Sir, how to differentiate between the concomitant symptom and keynote symptoms?
We have already given under keynote. What is keynote? If there is a mental concomitant in a physical condition, it is also a keynote. Concomitant can become a keynote, but keynote need not be a concomitant.
Yes, sir. I think we have done most of them.
Right.
Some people are asking about the menstrual bleeding during urination. Magnetic polysostria alone or any other remedy used?
Only alone, only one remedy, only one remedy.
Sir, some doctor is asking guidelines for fee structure in acute cases. Not to be discussed.
Because the patient gets completely cured, we know the definition of acute disease is that the patient gets completely cured, will voluntarily. So charge more and you face the consequences. And before we conclude, Dr. Shobha, I should invite all my friends in JH family to come to get Rajkot the blast in January. Please wait for the announcements. We are going to have the most beautiful experience in Rajkot.
Yes, sir. Just a minute, sir.
What is this?
Stop share. Is that
Have you
PPT
read that?
available?
What is that caught feeling? Huh?
Sorry, sir. Sorry. What are you asking, sir?
The caught feeling somebody wrote anyway. The
No. So, friends, the NJH is coming up with a just a minute. NJH is coming up with a annual SSMS in the month of January 2024, and we will be at Rajkot, Gujarat, and we will be we will be making the announcements from wherever you got the link of this webinar. Please do keep on checking it. Even in the NJH Telegram group, those of you who have not joined NJH Telegram group, please message or to any of us EB members of NJH. We will add you in that NJH Telegram group so that you get all the information about the NJH. NJH is going to do a annual SSMS at Rajkot on a bigger platform in January 2024. So please do keep on looking at that on the 6th and 7th of January. And do join us at Rajkot. The topics, the theme of that SSMS will be onto the advanced pathological cases and the acute prescribing. So those of you who are interested in it, please, it is a not to miss type of SSMS where you get to learn a lot of things. And any other announcement about the next webinar, the roundtables, as you all know, the NGH is conducting roundtables every alternate Saturdays and webinars on every alternate Saturdays. So all the informations are coming on to the NJH Telegram group. Please do join us. Thank you very much, friends, for your kind support. Thank you, Praveen sir. Under all the odd situations, you conducted a wonderful, wonderful seminar. Thank you very much, sir.
Thank you, Dr. Shobha. Thanks a lot. Thanks
Thank you.
all my NJH family and friends. Thank you very much.
Yes,
Thank you.
yes. Thank you. Thank you very much. Thank you very much, friends. Somebody's one participant is asking how to join NJH Telegram group. Friends, from wherever you got this link of this today's webinar, you can ask the question in the same group, or you can contact any of our NJH TB members. We will add you into the NJH Telegram group. Okay, friends? So thank you very much for today. That's all. Good night.